Hello everyone. My name is Barsa and I'm the new Community of Practice Manager for iCourts. For those of you who are new and are joining us for the first time today, iCourts stands for Improving Community Health Outcomes through Research, Dialogue, and System Strengthening. So we are a community of practice that centers around the social and behavioral sciences in the field of neglected tropical diseases. And our purpose is to bring together people in the field to learn and collaborate with each other. One way we do this is through our Knowledge Exchange Cafe webinars, which help us to hear from experts in the field and provide an opportunity to have a discussion on the concepts shared and learned. If you would like to be a part of the iCourts community, please click the link that I'm going to be sharing in the chat right now and fill out the Google form. So today's session will focus on how the social and behavioral sciences can help us combat zoonotic diseases through the One Health approach. We will hear from experiences in the Gambia, where significant progress has been made in implementing a One Health approach to combat zoonotic diseases and integrate human, animal, and environmental health sectors into their national NTD program. So during this session, please feel free to put any comments or questions you have in the chat, and we will address them in the discussion portion of the session, which will take place following our speaker's presentation. So I'm now going to pass it over to our session moderator, Dr. Allison Krentel, who will be introducing our guest speaker.
Great. Thanks so much, Farsa, and welcome everyone. Delighted that you're here, and it's my pleasure to introduce Mr. Bala Jatta, who is the current program manager for NTDs at the Ministry of Health in the Gambia. He is also the chair of the Kikundi NTD Program Managers Community of Practice. He's been an NTD program manager since 2018 and has participated in mapping of schistosomiasis and STH in the Gambia, and also participated in the development of the NTD master plan from 2015 to 2020, and then again in 2021 to 2025. He's been coordinating mass drug administrations for many years and holds a master's in business administration in public health from Carleton University in the USA. And he's previously served as an epidemiology and disease surveillance officer with the Ministry of Health, the Gambia, and also a public health officer at the Ministry of Health and Social Welfare. He's also worked as a trainer and supervisor at the Gambia Red Cross Society. So it's my pleasure to welcome Bala today, who will be sharing with us his experiences of One Health in the Gambia. And I think you will enjoy hearing from him and the learnings that we can gain from the Gambia. So Bala, over to you. Please go ahead. And you may just, I know your camera's not working, but you may need to just, there you go, unmute yourself.
Yes. Thank you very much, Alison. And can we have the slides, please? Good. Thank you very much once again, Alison, and good afternoon to you all, and thank you for joining this very important Knowledge Cafe. I am Bala Jatta, Program Manager for Neglected Tropical Diseases in the Gambia, and also Chair of the Kikundi Community of Practice for NTD Program Managers in Africa. So I'm going to take you through combating zoonotic diseases through the One Health approach. Progress made in the Gambia. Next slide, please. Yes, so that is going to be the overview of our presentation tonight. And yes, next slide. Good. I will start with introducing Kikundi, which is a community of practice for NTD program managers that was established as an idea or a concept that came from NTD program managers that met in early the 2020s in Seattle at the ASCMH annual meetings. And then from there, we came together as program managers to establish a community of practice that will look at the that will bring program managers together to share ideas, share experience, and work together, discuss and help each other solve unique problems across the countries. And we were able to establish this community of practice through the support of the University of Global Health Equity based in Rwanda and the University of Washington in the United States with financial support from the Bill and Melinda Gates Foundation. Next slide, please. So Kikundi is also, we have a membership base of almost all African countries, and the logo and the name African-based logos. We have the Adrika symbol, which signifies unity and community. It is a symbol that was taken from Ghana. And then we also have Kikundi, which is a Swahili word, means togetherness or a community. So bringing the sign and also the name together, that means we are uniting all NTD program managers in Africa through one group. Next slide, please. So we are managed by two councils. We have the Leadership Council, which I chair, and I have a co-chair, Anik, who is a program manager for Angola. And we also have an advisory committee which comprises of experts in the field of NTDs, and the development team, that's the University of Washington and the University of Global Health Equity, that supports in the day-to-day administration and programmatic management of the community. Next slide. So these are the current Leadership Council members that are working, that I'm working together with. You have Jean Bosco from Rwanda, and Ndeye Marie from Benin, Wycliffe Omonde, who is from Kenya, Dr. Anik from Gabon, who is also serves as the co-chair. I have Major from Namibia, Joseph Opare from Ghana, Alfred from Uganda, and Nicholas from Nigeria. These are the people that work together to decide on the day-to-day affairs of the community, but also to decide a way forward as to what is in the best interest of the community. So we don't just take unilateral agreements, we sit and discuss as a team to discuss issues affecting the community, where we do knowledge share, experience sharing, and with the support from the development team, we also have tailor-made courses that we undergo as program managers, like leadership in management, M&E, policy development and advocacy, and the list goes on. This, thanks to this support from the University of Washington and the University of Global Health Equity, we undergo this all geared towards improving the capacities of NTD program managers, and not only NTD program managers, but those that are working in the NTD teams at the country level. And so we bring everybody on board because we want to ensure there is continuity amongst NTD programs in the continent, because we know people move on. So once you move on, if your successor does not have the knowledge and skills to take over from you, they tend to start fresh from somewhere. So that's why we do all this experience sharing and learning so that we are able to make progress. Next slide, please. So coming to the topic, combating zoonotic diseases through One Health approach, progress made in the Gambia. Next slide. We all know One Health is a multi-sectoral and a collaborative approach that is transdisciplinary, bringing both human, animal, and environment sectors into one play. That's the human and animal and environment ecosystem, bringing them together to see how best we are able to collaborate and solve problems that are affecting not only humans, but also the environment and the animals together. Next slide. So the Gambia is located in West Africa with a population approximately 2.7 million, but this is unconfirmed statistics for now, because we are still waiting for the official statistics from the Gambia Bureau of Statistics. We just recently conducted census national census, but preliminary data that is out is we have approximately 2.7 million people. And then we have 14 endemic entities in the country, and out of which we have STH, soil-transmitted helminths, schistosomiasis, trachoma, rabies, and other entities that we're also working on the total of 14 entities that we work through. Next slide, please. The progress made in the Gambia in the aspect of One Health, we formed a technical working group on One Health at the technical level, and we have made progress to ensure that we have the political commitment and political will to between the three ministries, Minister of Agriculture, Minister of Health, and Minister of Environment, to sign MOUs and also come up with policies on One Health. But at the technical level, we have this technical working group that comprises of all these stakeholders, not including other stakeholders that are not in these ministries, like people, stakeholders from the Department of Water Resources, Department of Community Development, from the Red Cross, and from the security sector, trying to ensure that we have a harmonized approach to solve problems. And the Minister of Health has appointed One Health focal point, which is at the Epidemiology and Disease Control Unit. And this One Health focal point is the one coordinating all One Health and activities in the country. But notwithstanding, we have done significant progress in One Health. We have done the IHR PVS bridging workshop, where we looked at the IHR and the pathway for veterinary services to bridge them together to see where we have a gap as a country and try to manage or solve those problems and come up with a roadmap, a joint roadmap, looking at One Health, and then we posted that roadmap, and we're working towards the implementation of that roadmap. And out of that, we also did a multi-sectoral coordination mechanism workshop, where we brought all these sectors to see how best we can coordinate amongst ourselves and work together as a team. And then through a coordinated approach, we have been able to respond to a highly pathogenic avian influenza that happened earlier this year. We had an outbreak in birds. We had some birds dying in some of the bird reserve areas. Next slide, please. Good. So we were able to conduct a joint risk assessment that involved all relevant partners, including WHO, the World Organization of Animal Health, the West African Health Organization, FAO, and all other partners within and outside the country that came together to conduct a joint risk assessment looking at that highly pathogenic avian influenza, so that we are able to see where we are as a country, looking at the risk involved in terms of getting animal to human transmissions also, or subsequently human to human transmissions. Next slide, please. So at the technical level, we conduct capacity buildings for our One Health partners, and which include those from the environmental sector, from the animal sector. And we've also conducted a One Health leadership training in Ghana, where we've sent people from the Ministry of Environment, from the Ministry of Agriculture, and from the Ministry of Health to go and learn about leadership on One Health. But also we had a One Health outreach course that was delivered by the University of Gambia and the WOHA team at the national level, where we've trained over 30 individuals that came from different sectors, and we were able to train them on One Health for a period of 1 week. And these are the people that are also supporting in the coordination of the One Health platform at the technical level. Next slide, please. So significant capacity gaps were identified in the animal sector response abilities, resulting in training on incident management response. Because when we did the joint risk assessment, we realized that at the human sector, we have capacity to be able to respond to any public health event or emergency. But on the other hand, on the animal health sector, the capacities were very limited. So what we did is we had to, during the response for the HPAI, what we did was we did on-the-job training. But post the HPAI outbreak, what we did was we started to incorporate the One Health partners in our trainings, like when we were training on incident management systems or public health emergency management, we ensure that we have a very good representation from other stakeholders, from the animal health sector, from the parks and wildlife, and from the Ministry of Environment. But notwithstanding, we also make so whenever training we are conducting, like currently we are doing a training on emergency preparedness and response, we ensure that at least 10% of those participants are from the animal health sector or from the environment, so that we build that capacity. So a more effective approach has been developed for managing complex issues, for instance, surveillance activities for human African trypanosomiasis. We are currently conducting passive surveillance for human African trypanosomiasis because Gambia used to be endemic for heart, and but for the past 2-3 decades, we have not been seeing any heart cases. And as a way of ensuring that we don't have heart in the Gambia, we need to institute passive surveillance. But this was dictated by data that was coming from the animal health sector, because we are seeing that we have a lot of trypanosomiasis in animals, and especially in 3 of the regions where we have started this pilot for passive surveillance. We have been having a series of cases of trypanosomiasis in animals, especially in cattle and sheep, and this has dictated our response. It's because we have that relationship with the animal health sector, we are able to, through the One Health approach, we are able to get that data, and based on that, we are able to make meaningful decisions to be able to conduct surveillance in humans to see whether those trips that we are seeing in animals are also causing trypanosomiasis in humans. Next slide, please. So the impact of collaboration, we are collaborating on WAS initiatives. It involves the WAS unit of the Ministry of Health, the Department of Water Resources, and Department of Community Development. Just looking at WAS in the country, we have 3 different sectors that are working on WAS. And some are looking at the software aspect, and some are looking at the hardware aspect. Like the Department of Water Resources and Department of Community Development is looking at the infrastructure at the community level, where we ensure that there is safe drinking water, or we have access to good sanitary services like toilets and all those things. And then at the Ministry of Health, they're looking at other components of the WAS, looking at the and hygiene, they're looking at occupational health and safety, and all other WAS indicators that are available at the Ministry of Health. So the Department of Water Resources is integrated into strategic plans and activities, ensuring that WAS considerations are included in prevention efforts and risks. So that when we were developing the NTD master plan, we ensured that we brought all these stakeholders, because we cannot effectively tackle NTDs without tackling WAS constraints. So we were able to ensure that all these partners were involved in the development of the plan and had their inputs clearly in the outline in the plan for us to be able to tackle WAS in our interventions for NTDs. Next slide. Next slide, please. Thank you. So key challenges that we are facing as a country. Key challenges that we are facing as a country is the political commitment for now, because we went to a point where we were about to sign MOUs between the 3 ministries, and then there was a cabinet reshuffle where the ministers were changed, and then we'd have to reset and reinitiate our advocacy for the political commitment for One Health, which we are working on. And just 2 months ago, we had a mission that came to assess the country's capacity as on emergencies, and the issue of One Health was key on the agenda. And when we were doing the debriefing to the high-level policymakers at the ministry, it came as a key recommendation, and we are now making headway, and we're working very hard to ensure that these MOUs are signed. But before they are signed, we are able to conduct advocacy meetings, and so we have the political buy-in of the various ministers. They understand exactly what their roles and responsibilities will be in terms of One Health implementation in the country. So there is currently also no dedicated funding for One Health, which means we depend on external partners to support, like from the WHO, from FAO, from WOHA, and from the WAHO. These are the partners that are supporting us to implement some of our One Health activities. So additional external support is needed, including financial resources, technical and advocacy efforts. This is one area that we want partners to come in and support, especially in the area of advocacy, because this is where we sometimes most of these political leaders, they tend to listen to external partners. So once we have external partners supporting in the advocacy for this One Health platform, I think we'll be able to make headway. I think that's my last slide. With that, I say thank you very much, and very much open for questions. And once if you have any question, you can. It's back to you, Alison.
Thank you so much, Bala, for leading us through your presentation and sharing the experience from the Gambia. Unfortunately, Bala's camera is not working, so you're stuck with just me, everyone on the call today. So please put your questions in the chat box, or feel free to put your hand up. We really want this to be an exchange of ideas and questions, and also shared experiences on One Health, and particularly the role of social and behavioral sciences. So maybe while we're waiting for people to put their hands up or to put something in the chat box, I'll start off with a question for you. I was really fascinated by the description of the technical committee, and I think it's so important to establish that collaboration and political will by bringing together people at the central level. And I wonder if you could just talk a little bit about what some of the barriers or facilitators were in bringing that group of people together to be part of a One Health technical working group. So we'll maybe start with that question.
Can you come again? I didn't hear that clearly.
Yes, I wonder if you could just speak to some of the barriers and facilitators that you experienced bringing together that technical working group at the central level to talk about One Health.
Yes, okay, thank you for that. One of the barriers that we had was conflict of interest. Like everybody wanted to ensure that department or ministry is well recognized or well placed in the platform, and trying to get coordination or making so someone has to take the lead was one of the key challenges. But when we did the multi-sectoral coordination mechanism, we were able to sort that barrier out, and we were able to, and so we have that leadership structure, and then we were able to identify a lead ministry that will be able to lead the process and ensure that the platform is up and running.
And where was who was the lead ministry in the end for the One Health? Who did you land on?
Is the Ministry of Health is a lead ministry, okay. And the focal point for One Health is at the Ministry of Health. Okay, excellent. We have a question from Tebebu Alamayayu. Excuse me if I mispronounced your name. Would you like me to read your question? You also feel free to speak to it if you'd like. Okay, I'll go ahead and read it. I don't see okay. So the question goes, one common challenge in One Health is multi-sectoral collaboration and coordination. Every sector is more used to working in silos than together, often competing than cooperating. What mechanism has fostered working across sector at all levels? And was there a specific mechanism or approach that you used in the Gambia? Okay,
Bala,
good.
yeah, go
Like
ahead.
I
Over to
said
you.
earlier, yes. So like I said earlier on, at the technical level, we have that relationship, relationship between us as technicians at the lower levels. We have that relationship where we can easily talk to each other, even by phone or by SMS or by email, and share ideas and share experience. So this is where we started building up the concept, coming together, inviting each other to our meetings and our activities. And once we meet, we make sure we bring this as an agenda and we work together towards it. And that's where we started coming up with the proposal and concepts, and with support from our partners like WHO, WAHO, and WOHA, we were able to bring these stakeholders together to look at what challenges we are facing together as a team. Because we've seen that most of these diseases or activities that we want to conduct, unless we go One Health, it's always very difficult for us to be able to solve some of these problems. So that's why when we came together as technicians, we are able to make headway, and then we are able to convince the leaderships, our various leaderships at our levels, to be able to come up with this platform.
It's interesting to hear you describe the sort of genesis of the committee as coming out of the technicians. So, really understanding the rationale for the approach, and then bringing in the leaders and an advocacy approach. That it was really the technicians, that sound like, that pushed this, and now moving into areas of advocacy to ensure that that political commitment and willpower is there for the One Health agenda. Yeah, Michael, please go ahead and feel free to introduce yourself. Oops, we lost you. Let's see. Michael Rampadi had a question, and he's disappeared off my screen. All right, can you hear us, Michael? Yep, please go ahead with your question. I think you're still on mute, so please go ahead. Okay, or maybe while we're waiting, if you type it in the box, maybe we're not hearing you. So please go ahead and put it in the box if you're unable to unmute your microphone. So I wonder if we could maybe move on a little bit to, okay, so please go ahead, Michael, and just type your question into the box. That's fine, and I'll read it out loud for you. So maybe while we're waiting for his question, iCourts is a community of practice for social and behavioral researchers. And one of the things that we try and do is understand how social and behavioral research can contribute to advancing the NTD roadmap. And so one of the things that we, in my experience, haven't dealt with a lot is thinking about social behavioral research around animal husbandry in the community. And I wonder if you could speak a little bit to where you see an entry point or a role for more social and behavioral research when we think about animals and animal husbandry and One Health. So Bala, I'll pass that over to you.
Oh, okay. Thank you very much. And I think social and behavioral change research, especially in animal husbandry, is something that is very much needed, because all these zoonotic diseases that we're talking about 70% of diseases being zoonotic. And having the animal husbandry, because, like, for example, in the Gambia, most of the animals are, you have people that own them and then they live with them. So getting the perspective from the community where these diseases are coming from, for the people to understand what really is really involved when they're living with these animals or they're working with these animals, to see how best they are able to change, because it's their source of livelihood, and they work. Once they have diseases that affect these animals, their source of livelihood tends to change, because they may tend to lose a quite number of their animals. So bringing them on board and having their perspective of the research, or maybe getting to hear from them or involving them in research, I think will solve at least some of our problems in terms of making decisions for zoonotic diseases at that level, because we are trying to ensure that those that are directly involved are giving us their view of what is happening, what they're experiencing, and what we can learn from them. Because with the research, if we at the central level, at the national level, just go down and conduct research, collect information, come and we analyze it without getting the perspective of those that are doing the animal husbandry or that are living with the animals or working with the animals, it tends to we don't tend to get adequate information, or we tend to assume that this is what is happening. But once we involve them, they take to give us foresight information of what they're experiencing, their life experience in terms of rearing those animals or living with those animals. I think this will make headway and will improve our research, and will even make ensure that we are able to inform policies, and we make policies that will be very much representative to help combat zoonotic diseases. Over to you.
Yeah, I think you've raised some really important pieces there to latch onto, and I think the perspective that that can be forgotten is that animals are our source of livelihood for so many people in the communities where NTDs are endemic, and so understanding their perspective is so important. And that lens of this is their economic livelihood, I think is really important. And I also appreciate, communities do bring us really important perspectives on how they live, on how they understand our NTD interventions, how they understand and can participate in prevention. So I would just echo the need for more research in this area, particularly when we use One Health lens to look at NTDs. It's we haven't used that lens sufficiently, I think, in our social behavioral research. So I'd welcome anybody else on the call to share perspectives of where you think that would be also important. Yes, please, Bala, go ahead.
Yeah, so in addition to that, maybe we're talking about disease surveillance and early detection in livestock, where research focuses on improving the surveillance system to detect response to the zoonotic disease and other animals before they spread to humans. And this may include livestock health monitoring systems, and so developing tools and technologies for early detection in livestock. Maybe also we may talk about pathogen surveillance or cross-species pathogen detection. And we may also talk about vaccination and biosecurity in livestock, because these are areas that we need to work on, especially vaccination strategies, the biosecurity practices, because we tend to have a lot of bio waste from these animals that we deal with. And also not forgetting antimicrobial resistance, especially when we talk about vaccinations. And yes. Okay, over to you.
Yeah, those are really important points. And I think your example of HAT is a really good one. I am not a researcher that's worked in HAT, so I don't know if the experience of passive surveillance through animals is done in other places. And I would welcome anyone else to share their perspective on that. But I thought that was a really interesting example of where animals can be used to help understand the presence of HAT in an area. So I appreciated that example. and would welcome any other comments from the room of those of you who may have more other experiences on that. I wanted to just turn to Michael's question. Thank you, Michael, for your question, and I'll just read out here. So Bala, this is directed to you. Thank you for the presentation and congratulations for the pertinent initiative. I would like to know if you have any formal monitoring and evaluation or impact assessment that speaks to the medium and long-term targets of the One Health in the Gambia. So we'll start with that, and then I'll ask his second question after your response to that. So over to you, Bala.
Okay, so currently what we are doing is we've put up a One Health roadmap, and based on that roadmap, we have a monitoring indicators that we are monitoring on the roadmap. And this roadmap was developed based on the IHRPVS workshop that we had, and then we developed a joint roadmap for all the sectors. And we are also trying to follow the roadmap, looking at the indicators that we've put or we've assigned to ourselves for that implementation of the roadmap. And with that, when we have our stakeholders meeting, we're able to assess the level of implementation, and we see where we are falling short, and we're able to adjust. This is why we are able to look at the challenges and then also see way forward where we can improve upon. Over to you.
And just wondering for people in the audience, is the roadmap publicly available? Like, is there a link or something that we could even share as an amendment to this presentation when we post it? Other countries or individuals might be interested in seeing what a One Health roadmap looks like. I don't know if it's publicly available.
Yes, it's publicly available on the WHO website, but I will also try to look for the link and I can share it with you.
Okay, excellent. So the second question coming from Michael, since your funding is external, what expectations do your funders have, and what sort of financial commitment have they pledged period-wise?
Okay, for the funding, it's just ad hoc. It's ad hoc funding based on need. Once we have an activity to implement that requires funding, we try to approach a funding partner to say, we have these activities to implement, but we don't have the required funding. So we tend to discuss with them and share a concept note based on the activity at hand with them. And once it's approved at their level or they have the funding to support it, then it is supported. So it's not fixed funding that is available to say this particular number of years or months, we are going to give you this amount of money to implement this number of activities on your One Health platform. But it's ad hoc based on requests. And whenever there's a need, we tend to approach the partners to request for support.
Okay, thank you. Michael, does that answer your questions? Or if you have any follow-up, please put it in the box. And I'll just make sure I'm not missing any other questions. If anybody else would like to make a comment or put your hand up, please feel free. Okay, yes, we have a question from Tina Lines. Tina, would you like to ask your question live, or would you feel free to unmute yourself if you like?
Hello, thank you for your presentation, Bala. Just wondering if you've been working with any local health advocacy groups in the Gambia, or even if you're working across different countries on advocacy in the region. Thank you.
Okay, at the country level, we have different stakeholders, and we use those stakeholders to do the advocacy. But at the community levels also, we've ensured that our regional staff are also trained on One Health, and they understand the One Health perspective, so that when they are implementing activities, we want to ensure that they also put One Health at the back of their mind, that they don't just implement activities that are geared towards health, but also ensuring that the One Health partners fully involved. So part of the roadmap is we are supposed to do community engagement also to engage faith-based organizations, community-based organizations, and other organizations to engage them and so they understand the process of One Health or the One Health approach. And then we have not started that, but it's part of the plans that we have put in place to, and so they are engaged, and then we work with them to implement One Health in the country. I hope that answers.
Yes, Tina, is that any follow-up or does that answer your question?
No, I think that does answer the question. It's more about working with people who are doing the work and trying to use their experience in advocacy pieces and getting them engaged that way, and also working within different leadership structures within communities. Thank you.
And I think, thanks, Tina. And I think certainly that, you know, thinking about One Health, there is a role, and as you mentioned, Bala, you know, trying to get that political will and political commitment. The advocacy has to be really an important part of that, and also engaging the local associations and national associations in the Gambia, I imagine, would be very important to sort of stress why this is important to Gambians and why they want their government to pay attention to a more One Health approach. We have a follow-up from Michael. Thanks for the responses. How did you grade or scale the priorities for the zoonotic diseases that were addressed? And were they all classified as neglected tropical diseases? Over to you, Bala.
Yeah, we didn't just grade the diseases like that. Like I said, we had a whole week together, all the sectors, and then we looked at the priority diseases, and then we looked at which ones have a greater burden in the country, and we tried to grade them based on the level of severity or based on the burden of those diseases. But also we try to prioritize. They are not all of them are zoonotic NTDs. Some of them are zoonotic diseases that are of interest to public health, but some of them are NTDs, and we have NTDs that are related to animals and NTDs that are related to humans, but we also have cross-cutting NTDs that we're working, that are part of the list of diseases that we've put on the list of diseases for One Health.
Thank you. Okay. Are there other questions? I want to make sure I'm giving everyone a chance to ask a question or provide a comment. I wonder if, and I'll just, while we're waiting for another comment to come into the chat, Bala, I wonder if you could put your chair of Kikundi hat on right now. You've had your program manager, NTD program manager hat on for most of this discussion. I wonder if you could just speak to, within Kikundi, is this kind of initiative around One Health something that is being raised by other program managers on the continent, and just kind of some of the, if you could just speak a little bit to the importance of this with your fellow Kikundi partners.
Yes, so One Health is one of our priorities as NTD program managers in Kikundi, and they just recently concluded NNN conference with, on behalf of Kikundi, I made a presentation on One Health and how the global NTD community can support One Health, the One Health approach in terms of dealing with NTDs. So it's a priority for us as Kikundi members, and during our community conversations, we have discussed extensively on One Health, and we have on our platform, we do discuss about One Health and how we can work together to solve One Health issues. And I think we are even working on, I guess you can correct me if I'm wrong, I think we're working on how best to conduct One Health research in collaboration with other partners, see how best we are able to get the One Health approach up and running within the continent as a program. But One Health, as for us as Kikundi, One Health is our priority, and we are working on it very well too. And so because one thing that we also want to do is, and so we have implementation and operational research instituted. And if you want to work on this, you must have also work on One Health to be able to bring all those perspectives together, because you cannot effect if you don't go One Health, because these entities, you need a lot of interventions that include One Health. Yes, over to you, please.
Thank you. I think that's a wonderful, it's almost a tagline. We won't address NTDs if we don't address One Health. Ghazi, I want to give you a chance to respond or add the perspective as a community manager of Kikundi.
Thank you so much, Alison, and thank you, Bala, for your presentation as well as insights. I think Bala covered what I would have normally said as well. But just as you mentioned, we are working with different partners to explore how we can support countries in the implementation of One Health approaches in their programs. And we're also working with program managers and other partners as well to even look at the lay of the land. There's a lot of different countries implementing at different levels, different One Health initiatives. And also on the other hand, you also have countries who might be thinking about One Health, but haven't made any concrete steps in that area as well. So currently, we're also working with our membership to see what that looks like on the ground, like who is doing what, to what extent have they incorporated the One Health approach in some of their programming as well as implementation. So this will be an ongoing activity we'll be engaged in over the next 3 years. And as I mentioned, if any partners are interested in supporting us or engaging with us and program managers to explore this topic, we're also happy to do that as well. Back to you, Alison.
Yes, I think your two comments and interventions are really teeing up nicely Michael's question, which is also my question. And I think there's nice intersection of this I-CORDS community of practice with what Kikundi is looking for. So I wonder if, and I'll just read Michael's question, but I have the same one. So first, Bala, do you have anthropologists or social science experts who are working in your team? And then I would so that'll be my first question, and how their expertise might shape the approach you've taken. And then I have a follow-up question on that. So if you could just maybe talk to the involvement of social scientists or anthropologists currently in your team and in the development of the One Health approach. Over to Bala.
Yes, so okay, thank you very much for that. What we're doing now is trying to, and so we're doing a mapping of all stakeholders and expertise in the country to see how best we're able to get everybody on board. As for now, we've not got specifically some specific people with experts on as anthropologists, but we have people that understands what social anthropologists do, and we're working with them. But we're also doing a partner mapping or stakeholder mapping, and we're doing human resource mapping also to ensure that we have everybody on board that will be able to post the One Health agenda, because this One Health is a priority for us as a country. And every week or day, almost every day, we talk about One Health, and so that we are trying to push the One Health agenda and trying to improve our disease prevention and control as a country. So one thing that we are also doing now is we are working on having a disease prevention and control policy as a country that will encompass all these prevention and control programs, and so we have a unified voice that everybody is going to work on towards. And this is One Health is as an indicator is clearly highlighted in that concept.
Yeah, I think that's Thank you. That's very helpful. And I think it sounds like this is the first step in the stakeholder is identifying partners that could contribute in this area. I wonder if I could put you on the spot here a little bit. I know I have been for the last little while, but you know, you're speaking to a community of social and behavioral scientists, people who are interested in seeing how that kind of research can help us reach our NTD goals. What would be an ask to this community to advance the One Health initiatives in the Gambia, or thinking more broadly as the Kikundi chair? What would you like ICORDS to support? I know it's a tough question, but I think it would help us also in communicating to our members.
Yes, so I think the area of One Health is something that is not really looked into as a country, or as a continent, or as partners and stakeholders on the or wider world. So what I will ask, for me, my initial thought is looking at advocacy, where we need to support countries that want to establish their One Health platforms. How do we support them with advocacy to be able to convince their leadership, political leadership, to ensure that this One Health concept is well understood at that level, at that top level, where you have the ministers or the prime ministers or permanent secretaries or presidential level, for them to understand the concept of One Health. And once we are able to achieve that critical milestone, to convince or be able to get that established at that level, I think we'll be able to institute or implement One Health effectively as we want to. Over to you.
Thank you. I think you've raised a really important point, and I think you know, you need to have that global push also, right? And the national push. So it's kind of that you need it for coming from below and also coming from above in order to support those advocacy efforts. So I think that's a great call to all of us to think about how we can further support those advocacy efforts. And I know that's something that Kikundi is also very engaged in. And then I think we can also think about
You're breaking,
I
can't hear you.
Oh, sorry. Okay. Maybe I turn my video off. Hopefully others can hear me okay. But I think you've raised an important point about the value of advocacy at all levels, both the national, global levels, but also within countries, and how social and behavioral research can help to strengthen those advocacy efforts. So I think we've certainly heard that call and really appreciate that call to our membership. So I don't see any other questions coming up in the group, or hands up, or any more in the chat box. So I just want to thank you, Bala, for your time today, for being willing to share the experiences of the Gambia. It's great for us to have a session like this. We haven't really talked much about One Health within ICORDS, and so we really appreciate your time in bringing it to the group and being able to hear the perspectives from yourself. So I will just pass back to Varsa, who will wrap us up with some final remarks. So thank you once again, Bala, and thank you everyone for your attention and for your questions. So over to you, Varsa.
All right. Thank you to Mr. Bala Jatta for your amazing presentation, and Dr. Alison Krentel for moderating our session today. And thank you to all of our attendees for taking the time to join us today and ask questions. So for those of you who are interested in becoming an ICORDS member, I have put 2 links in the chat. One is for the website, and you could click on that to fill out the Google form. And then the second link is a link to our LinkedIn page. So if you enjoyed this session, please connect with us on LinkedIn for updates about any future upcoming knowledge cafes, as well as opportunities. So thank you, everyone.